Hey guys, welcome back and happy Wednesday. If you didn't know, March is Women's History Month, and it also happens to be Endometriosis Awareness Month. So I thought that this would be the perfect month to talk about endometriosis and give you guys a routine that if you are an endo warrior, you can do to kind of help relieve some of your symptoms. So I'm not going to go super into depth about what it is, how to treat it or try to treat it, because it's very, very complex. There's a lot to it. I'm going to link a bunch of stuff down below. And before I get started, I just want to give a special thank you to my friend Jen. We've been friends for a couple years. She is an endo warrior and she sent me all of these wonderful resources and really helped me on my journey to understand endometriosis. She also was super transparent, answered all my questions. She's also been really great about sharing her journey along the way. So just special thank you to you, Jen. I really appreciate all of your help. So what is endometriosis? If you don't know, chances are if you're here, you probably already know. So go ahead, skip forward to the routine. That's fine. Endometriosis is when endometrium, which is the tissue that grows inside of your uterus, starts to grow outside of your uterus. It typically entangles itself around your ovaries, your fallopian tubes, the outsides of your uterus, and things like that. However, it can move around anywhere in your pelvic region, bladder, your anus, anything like that. And there have actually been some reported cases of people finding endometrium lesions in women's brains or uterus owners' brains as well. So it can be pretty much anywhere, which is why it is very difficult and very hard to treat. Treatment and diagnosis itself is very complex. It takes on average about 10 years for a uterus owner to actually get a complete endometriosis diagnosis usually, and they have to go through multiple doctors, multiple treatment options, countless appointments, prescription drugs, sometimes even surgery, and no two treatments are ever alike. What works for one woman and one uterus owner may not work for the other. So what causes it? It's currently unknown. It's being researched. There's not a lot of research having been done, but there is research going on. And right now I'm going to list it off. It's going to be a minute. Some studies that are currently going on trying to look for causes are ones that involve genetics, hormonal imbalance, retrograde menstruation, immune system dysfunction, lymphatic system issues, metaplasia, and stem cell theory, just to name a few. And the symptoms include, but are not limited to, painful menstrual cramps, pain with intercourse, intestinal pain, pain with urination, infertility, fatigue, and neuropathy, which is nerve damage, if you don't know. So how can exercise help? So it can help relieve endorphins. I mean, a lot of times there is kind of a hormone imbalance factor. There can be a lot of depression and anxiety that goes hand in hand with endometriosis. So it can help with endorphins. Of course, it's not going to be a cure-all. But it also, you know, when we're in pain, and if you can imagine your pain, especially radiating from right here, we tense up. We tend to curl up into that little ball, that fetal position, and that affects our posture over time. Also, pelvic inflammation leads to pelvic dysfunctions, which can cause, you know, urinary incontinence issues, as well as bowel urgency, things like that. Inflammation can also cause pain in our low back and also affect our posture as well. So we're going to focus today on strengthening the glutes and the core to help with those postural issues, as well as the muscles in the back of our shoulder area. And I'm also going to do a little stretching, especially some sort of like twisting movements are great when you have some issues with your pelvis. It can really help with the blood flow as well as the lymphatic drainage. And it also helps with the pain and the neuropathy. So without further ado, we're going to go ahead head on back here. Today's routine, we're going to be doing about a minute of each exercise / stretch, and all you will need is a foam roller. I have one of the smooth ones. If you have one that has bumps on it, that's totally fine, but I don't suggest having one that has the large bumps for deep tissue massage, because we are mostly just going to be using this to assist ourselves in some stretches. If you don't have a foam roller, grab yourself like a big Nalgene, a hydro flask, something like that. Another option would be to use just like a exercise ball or a playground ball. You don't necessarily need a foam roller to do these exercises. I just suggest it. So without further ado, we're going to get started with some breathing. I'm just going to go ahead and sit down here. Now your diaphragm, your pelvic floor, your core works as a canister. So when things are off, when you have pelvic imbalances, it can't function as a canister. So we're going to be focusing on some diaphragmatic breathing, working on our pelvic floor, then we're going to go into some pelvic breathing, and then we'll get started with our exercise. So we're going to get started here. Sit up nice and tall, roll those shoulders back and down. You can sit supported if that feels better in a chair. We're just going to take a nice deep breath through our nose. Deep, nice 360. I want you to feel that breath in your belly, in your chest, in your back. Everything is expanding wide And as you exhale, I want you to really focus on tightening things. You're gonna feel that pelvic floor lift up, like your core sitting down and around. So we're inhaling through our nose. Nice and wide here. Exhaling through our mouth. Forceful and loud. I feel everything coming together here. It's like a little zipper going right up. My ribs are coming together. My pelvic floor is lifting up, almost like I'm doing a Kegel. And I'm gonna inhale and relax it all. Perfect. Keep breathing here. After this, we're going to move into some elevator breathing. I'll explain that in just a second. Let's go for one more here. All right, some elevator breathing. We're going to do that same inhale. Everything's going to relax. Everything's going to let go. We're going to grow nice and wide, 360 breathing. As we exhale, we're going to exhale in 3 phases. And we're going to lift our pelvic floor as we do so. So we're going to go up, up, and up. So we're going to go high, higher, highest. I want you to think of that pelvic floor like an elevator. So let's go ahead and start that now. So nice deep breath. First, exhale high, higher, highest. And let it all go. Nice deep inhale, 360 breathing. Last one here. All right, let's go ahead and get into those exercises. Take those legs out wide. We're gonna do a saw here, work a little bit on those twisting exercises. I want you to take your arms up like a T here. Sit up nice and tall. Nice deep inhale. And as you exhale, I want you to go ahead, saw to one foot. Bring it up. Let's go ahead and do the other side. We're gonna get a nice stretch along the back of our thighs as well as this side. And this should feel as strong as like an oblique crunch. I want you to really focus in on your core here. If you have had an exploratory surgery during your endo journey, I also want to mention that you can really benefit from scar massage. I have a C-section scar massage video that I'm going to link at the end of this video for you. It's not specific to C-section scars. If you have any abdominal scar, you can definitely benefit from doing a nice deep tissue massage there. Let's go for one more each side here. All right, let's go ahead. We're gonna come down onto our hands and our knees here. We're gonna go into a nice cat and cow if you're familiar with yoga. So knees are right underneath those hips, hands are right underneath those shoulders. Nice deep breath. Exhale, I want you to tuck that tail and that pelvis under. We're gonna look right down towards our pelvis here. My back is arching up like a little Halloween cat. And as we inhale, we're gonna go ahead, send those glutes and that heart up towards the ceiling, look up towards the sky. Hopefully stretch out that back. It gets crunched up when we tense in pain. As well as strengthening our core for our spine alignment. And getting a nice stretch throughout that pelvic region as well. After this, we're gonna go into a bird dog. We'll be lifting one arm, one leg off the floor. Focusing on core stability. Go ahead and find that nice neutral space with your back. I want you to tense that core just a little bit so we're keeping that low back nice and stable. We're We're gonna lift our right hand and our left foot up just in line with our shoulder and our hips. Go ahead and set that down. We're gonna go ahead and go to the other side. Use your core here to keep you nice and stable. If you find yourself rocking a lot back and forth, go ahead, take your hands and your knees just a little bit wider. During a balance challenge, if we increase that base of support, that'll help add a little extra stability as well. All right, after this, we're gonna be laying down on our stomachs, working a little bit more on our back. We're gonna be going into some Supermans. Last one here. Let's go ahead and take it on down. We're going to be laying flat on the floor. Really think about pressing that pelvis into the floor. That's what's going to protect our low back. Hands come up by your ears. Nice deep breath. And as you exhale, I want you to lift those legs and that upper body up off the floor just a couple inches. And go back down. Exhale up. So you're checking in with that pelvis ever so often, making sure we're not taking any tension into the low back. All right, we're gonna go ahead and take this into a swim in just a few seconds here. We're gonna be extending both those arms out straight. Let's go ahead, go there now, stake those arms out nice and straight. We're gonna be lifting up here, one side at a time. So I'm going to take my right hand and my left foot up, lower those down, and then we switch sides. So just like we were doing that bird dog, but this time we're laying on our stomach and we're keeping that pelvis tucked, really working on strengthening those muscles right along the spine. Keep breathing here. Check in with that pelvis every once in a while. Make sure that you're keeping it nice and neutral. We've got about 10 more seconds here. All right, go ahead, bring it on down. We're gonna roll over onto our backs here. We're gonna work a little bit on our core. So we're keeping our knees bent and our feet flat on the floor. Go ahead and roll yourself on down. We're just gonna go for a little chest lift. I want you to keep those arms by your sides. We're gonna float them just a couple inches off of the floor. Nice deep breath here. As you exhale, I want you to tuck that chin, lift your upper body up off of the floor, look down towards your pelvis. Really focus on hollowing that belly out, tuck it in towards your spine. Inhale and come back. Perfect. So as we're coming up and exhaling, we're activating those core muscles and that pelvic floor. Last one here. All right, from here, we're gonna go ahead and go into a leg stretch, working a little bit on those lower ab muscles. Tuck those knees up into your chest. I want you to grab right around those knees. We're gonna take one leg straight out, bring it back, and we're gonna take the other leg out. You have some options here. If you wanna add on a little bit more core emphasis, you can come back up into that chest lift. Just make sure that you're keeping that chin tucked, just like you're juicing an orange. You're looking at those thighs. Perfect. We've got about 20 more seconds here, and then we're going to focus a little bit more on that back body one more time. We've got 5, 4, 3, 2, And one. Go ahead, bring it on down. Knees are bent still, feet are flat on the floor. We're gonna go for a little pelvic rock. I want you to imagine you have a marble on your lower stomach. We're gonna tuck that pelvis in towards our belly button. That marble is rolling up towards our chest. And we're gonna go ahead, take that pelvis back to that starting position. Marble goes back to where it belongs. You might be able to find a little space between your low back and the floor. This is helping strengthen that pelvic area where we might feel some dysfunction, as well as strengthening the glutes just a little bit. But I want you to really focus on the core here as you tuck that pelvis in, not just the glutes doing the work. All right, in about 10 seconds, we're gonna go ahead and go into an articulated bridge. We're gonna stick with that pelvic rock and we're just gonna roll that spine up off of the floor. Let's go ahead and do that now. So let's move into our pelvic rock and we're gonna slowly roll that spine up off of the floor, one vertebrae at a time, just until we get to those shoulder blades. And then I want you to go ahead and do the reverse. We're gonna slowly roll that spine back down, working through a nice C curve in our spine. Our tailbone is the very last thing to touch down. Perfect. Nice inhale at the bottom. Exhale, roll it up slowly. Inhale at the top, and exhale, roll it down. This strengthens our glutes and our hamstrings, helps with any sort of postural imbalances. And it helps perk up the booty. Nobody's mad about that. Let's go for one more here. All right, go ahead, grab that foam roller, keep those knees bent, feet on the floor. Or just go ahead and lift up onto the balls of your feet. We're gonna place that foam roller right along our tailbone. Right, it sounds vulgar, but right where that booty crack meets your back. And I want you to just go ahead, take your legs up towards the ceiling. This is just a nice stretch, a nice release for that low back that tends to get crunched up. If it feels more comfortable, you can tuck those knees up into your chest. You can keep them straight out, whatever feels good for you. One more nice deep breath here. Go ahead, grab onto your right knee, and I want you to send your left leg down to the floor. Perfect. It doesn't have to touch all the way. I want you to squeeze that left glute. Oh, you're gonna feel that nice stretch right along the front, right along these hip flexors that are really close to your pelvic region. They can tend to get a little inflamed as well. Bring it on up, let's switch. Squeeze that glute. One more nice deep breath here. All right, bring both those feet back to the floor. Go ahead, grab that foam roller on out. We're gonna sit up for just a second here and we're gonna place that foam roller right underneath our shoulder blades. I want you to bring those hands by your ears, knees are still bent here, and just slowly lengthen yourself over that foam roller, just as far as feels comfortable for you. If you want to hold behind your head here with your hands, make a little hammock for your head, you certainly can. If you want to melt all the way down and touch the crown of the head to the floor, you can do that too. This is just a nice deep stretch right along that part of our spine that tends to get hunched over, not just when we're in pain, but just when we're living our everyday life and over things. here. All right, go ahead, bring it on up. Last foam roller stretch here. We're gonna place it right underneath our neck, right at the base of your skull. We're gonna do a little trigger point releasing on our neck, which can again get nice and tight. I just want you to go ahead and move your head side to side, just like you're saying no. Nice and slow. And if you find anything that has a little extra tension, feel free to spend a couple extra seconds there, adding a little bit of pressure to help work it out. Go ahead, bring that head back to a neutral position. We're going to do another little stretch here. I want you to take that chin up towards the ceiling and go ahead, bring it down. Give yourself a little double chin. It's okay, you're at home, nobody can see it. Last one here. Now you can go ahead, grab that foam roller out, tuck it off to the side. If you'd like to keep it to cushion your head, you can do that as well. We're just gonna go ahead and get into a nice figure 4 stretch here. I want you to take your ankle over your opposite knee, grab behind that thigh, and just give yourself that nice stretch in your glute and your hamstring. Sometimes during endometriosis flares, we can get some nerve pain running down the back of our thigh and our glute. And this can just help release any of those neuropathy symptoms that you might occasionally experience. One more nice deep breath here, and we're going to go ahead and switch those legs on out. Perfect. Go ahead, switch those legs. Again, grabbing behind that thigh, or maybe just keeping your foot on the floor is enough of a stretch for you. You can even take your hands a little further, grab along the outside of your shin, wherever it feels comfortable. One more nice deep breath here. All right, go ahead, unwind those legs. We're gonna go for a little butterfly stretch here. Go ahead and meet the bottoms of your feet together. Grab onto them just like a little happy baby. And if it feels comfortable to pull those feet in towards your chest for a nice inner thigh stretch, you can do so. If you would rather take those feet apart and pull those knees down towards the ground, you're more than welcome to do that as well, whichever feels like a deeper, more relaxing stretch to you. This is our last stretch here. We're going to hold this for just one more nice deep breath. All right, go ahead, undo those legs, bring yourself back up to seated. Thank you guys so much for being here. I hope that you found this helpful. I hope that this is great for you to help relieve some tension whenever you're experiencing an endo flare. If you liked it, please by all means leave me a thumbs up, like, subscribe, hit that bell, you know the drill. And if you feel comfortable, if you want to share your endo warrior journey, by all means leave those in the comments. I think that it can help us feel very empowered and not so isolated when we're dealing with something that's a chronic illness that's not entirely understood yet. If you'd love to share, I would really appreciate it. So thank you so much for being here, and I will see you again on Sunday.